Business News.
All right, time now for Better Pets. Paul, you love snakes?
Snakes are one thing you definitely don't want your dog investigating while you're out on a walk.
They scare me. And did you know there are venomous snakes here in Connecticut?
Dr. Andrea Dennis of Bloomfield Animal Hospital is here with some tips on how to avoid dangerous interaction and what to do if your dog is bitten by a snake. I don't really think of snakes being venomous here in Connecticut.
And most people don't. And we have two types. We have the copperheads, the northern copperheads, and we have rattlesnakes, too.
You're kidding.
No, we have one type of rattlesnake. Now, the timber rattlesnake is somewhat extinct, so I'm not going to concentrate on that so much.
Okay.
But the copperhead is something that they look gorgeous, but because most of us are not aware that copperheads are venomous, you want to be able to identify them. And they are usually two different colors of brown, a bronzy color, and they have an hourglass pattern on their body. And to be able to ID them is just so important in terms of the health of your cat and dog, you know, in terms of if they're possibly bitten. And then, of course, the rattlesnake has the little rattle at the end. But
they're here in Connecticut.
Yes, we do have that one, but they're somewhat protected here in the state of Connecticut. I mean, the DEEP doesn't recommend anyone destroying or hurting snakes because they are part of our, you know, sort of our nature pattern, and they are here for a reason. But we need to be aware of them, and we need to make sure that we're safe with them.
I just love the fact that they're protected, but we're not.
What can we do if the unthinkable happens and one of our beloved animals gets bit? What do we do?
The first thing was I would just take a picture of the snake because most people can't identify me, and it's your baby, you're panicked, you're worried. So if you now with iPhones or any kind of
that's if it sticks around, right?
But usually they will. You can sort of still see it go away in just a quick photo if you can. Just sort of think so you can identify it to the best of your ability, and then please seek veterinary care. If we could I'm all about prevention, you know that.
Absolutely.
And if we could prevent this from happening, the best thing is even on a nice walk in the woods, as what appears to be a safe walk, keep your dog on your leash.
Absolutely.
Because then you can see something maybe stirring in the pile of leaves, and that will just be very helpful to sort of pull them back. Now, I want to let people know, I don't want them to panic because this is not a common event, but because it did happen earlier this month, it was a large dog. It was a golden retriever. It was, which is almost a good thing because of the fact that they can handle more venom. That dog survived without a problem. I had a patient that was a Sheltie, you know, the Shetland sheepdogs.
Oh, no.
It was bit over the eye.
Is this a sad story?
It did not survive, and that's why you just don't know. It's not up to you to decide whether you think it's going to be okay. They can go home, and maybe you'll seek veterinary care in the morning. Don't wait.
Don't wait. Get to you right away.
Please don't wait. Yeah, and I think also too, if we can, we're lucky in that most animal hospitals do not carry antivenom, but UConn does. So that's when we can reach out to the University of Connecticut and get that.
That's excellent.
So, you know, so this is what your veterinarian would do. They usually want to keep them overnight at least, to put them on IV fluid therapy. It's all about pain control because these little suckers hurt and they get very inflamed. Sometimes they'll use antibiotics as well. But we leave that to us to take care of them. But it's mainly up to you to bring them to us.
Okay, so there are different treatment types, right?
There are. Like, not every dog needs to be treated like I said, with the antivenom. And then too, for people, you know, it's the cost. You know, some of these things are not inexpensive, and I know sometimes people say, listen, do what you can, but I cannot afford the antivenom. We have to do that in veterinary medicine all the time. We give what we can do, but again, most dogs are going to survive. That's one takeaway that I want to make sure everybody has, and just be aware that they're in your path. And most of them, I'm sorry, I don't want to interrupt.
No. I wanted to.
But most of them are west of the Connecticut River, here in Connecticut River. So both the dogs that we talked about, it was the West Hartford Reservoir, but both of them were bitten.
Do you want to bring attention to National World Rabies Awareness Day?
I do. That's today.
Oh, it is today.
It is absolutely today. So I thought, how coincidental, and let's just discuss it because most people don't think their animals need to be vaccinated for rabies.
No,
they're not sure how often they need to be vaccinated, and why this is so important is that we can get we can get rabies. And if we don't protect our pets that could bring it into the house because they're bitten by a rabid animal, then it's just not a safe environment.
Okay.
Does that make sense?
No, it does make sense.
How
Thank you.
often again?
Well, it depends. Most cats need to be vaccinated every year.
Every year.
And most dogs, it's every 3 years. And people that say, oh, my cat is inside. I have an indoor cat. Well, bats get in the house. Little critters get in the house.
Paul's mother comes often.
There we go, Jennifer.
We had to get a joke in.
We almost got through the whole
I
segment.
told them to behave for this segment with the information. Listen, as a reminder, Dr. Dennis is the owner of the Bloomfield Animal Hospital on Old Windsor Road in Bloomfield.
And on alternating Saturday afternoons from 2 to 3, she's taking questions from listeners on Pet Talk and WTIC 1080 radio. So tune in if you can.
All right.